Last month, we told you that heart disease is the #1 cause of death for women. Well, according to the CDC, the same holds true for men across the United States. Several medical conditions and lifestyle choices can put men at higher risk for heart disease, including high blood pressure, high cholesterol, diabetes, smoking, being overweight or obese, and drinking alcohol. The specialists at Florida Hospital Waterman's Heart Center explain that 90% of heart disease patients have at least one of those risk factors.
That is correct, but obesity is one of the multiple risk factors to develop heart disease. Obviously, diabetes, hypertension, smoking, genetics, and family history are definitely the most important risk factors for heart disease. But you can definitely see a trend. I mean, I remember maybe being very young, usually if it's, you see anybody in the 40s or 50s or late 30s, and you have any things that says, oh, don't worry, it can't be your heart, you're too young. That's a disease for an elderly person. That is not true anymore.
There's a phenomenon, that we've described now in the medical literature. It's called diabesity. And it's the idea of diabetes and obesity and how that affects patients' cardiac risk factors. Most of that, probably 80% of that, is centered around obesity. As patients become more obese, their risk of hypertension increases. It's connected to hypercholesterolemia. It's connected to diabetes. As a society, we become less active and more dependent on fast food type of nutrition. And we see the results of that. And unfortunately, we see a lot of those results in our children. Among the risk factors for cardiac disease, stress is perhaps the most difficult one to manage, because if you're alive, you have stress. I don't care who you are. I think even probably a shepherd up in the mountains has got some stress. And it's not measurable in the same way blood pressure or cholesterol is, but it's also very real, because some of their stress, I think, is derived from the fact of their numbers not being good. You walk around, you're 40 pounds overweight, your blood pressure is 200, and all these other things. That creates its own separate stress.
If you smoke, quit smoking. If you never start smoking, don't start. Obviously, tobacco is bad. First hand, second hand is obviously a bad thing. Obviously, exercise is a good thing you can do, and try to eat healthy.
There are ways to prevent heart attacks. The American Heart Association and the CDC recommend at least 10 minutes of brisk exercise daily to reduce your risk of heart attack by 50%. And if you can increase that to 30 minutes a day, you'll decrease your risk of heart attack by as much as 75%. You'll find more information about the staff and procedures offered at the Waterman Heart Center when you click the Heart Disease Story link on our homepage at yourhometownhealth.com.